Good morning, everybody. We're here to talk about your favorite subject, contracts, billing, and insurance. If you don't know me, I'm Melinda Turpin. I'm the accounts manager downstairs on the first floor in accounting. I also oversee the purchasing department, and I've been here for 24 years. I'd like to introduce my new assistant. She's my new right hand. This is April. She's the one sitting outside my office now, if you haven't met her yet. She's going to learn what I know, so pray for her. So let's get started. So do you know what your contract covers, or do you even know where it is? It's been a long time for some people. So we have different types of contract options that are available to you when you moved in. You have the life care contract that guarantees your apartment or cottage rate when you temporarily or permanently move to healthcare or assisted living. The limited life care, or a 365-day contract, allows you to take your apartment or your cottage rate to assisted living or healthcare for 365 days. On day 366, you revert to the published rate, which we'll be seeing shortly. Also remember, when it comes to your contract, it depends on were you here before the new building or after the new building when you signed your contract. So in healthcare, the discount rate for this contract is different depending on when you signed your contract. Fee for service. You'll be responsible for the daily or monthly fee in assisted living minus 5% if you move before July 31st, 2019, or minus 15% for healthcare only, I didn't put that in there, if you moved after August 1st, 2019. If you are temporarily in assisted living or healthcare, you'll be responsible for paying for your cottage or your apartment fee, plus the fee for the room you're in assisted living or healthcare. Think about it as if you were still living at home. You still had to pay your mortgage when you went to the hospital. When you are permanently transferred, you no longer have to pay your apartment or cottage fee. You will now pay the published rate for assisted living or healthcare wherever you are. If you're in healthcare temporarily under a Medicare Part A stay, you will not be billed for that room and board because Medicare is covering that while you're in healthcare. So that's for up to 100 days. Again, with the fee-for-service and limited discounts, you have a 5% discount on your monthly fees in assisted living and a 5% in healthcare if you signed your contract before July 31st, 2019. For everybody who signed after the building, or August 1st, 2019, your assisted living is still the same 5%, but healthcare you receive a 15% discount. And you'll see why eventually. Assisted living, memory support, and healthcare have some additional fees that if you look in your contract under page 4, under inpatient services, it explains what those fees could possibly be. It doesn't give the dollar amount, but it tells you about the fees. One is a suite fee. So if you move into an assisted living suite, it's 2 rooms. So to have 2 rooms, an additional $758 a month. Memory support, if you go to memory support in assisted living, it's an additional $500 a month. And this is for our life care contracts and our limited life care contracts, not for fee for service. I want to clarify that. Healthcare and some of the newer contracts has an additional healthcare fee, which is $500 a month. Now, the suite fee and the memory support fee are waived if a couple share a room or share an apartment, a suite. So here are the published rates as of October 1st, and they are good till September 30th, 2025, for assisted living for our fee-for-service residents and for our residents who have the limited 365-day contract when they get to day 366. So I know you've gone to some of the other transition seminars. They've talked about different levels of care and assisted living depending on your activities of daily living. So Lene assess you. She'll come and assess and see what your needs are, and then she lets me know what level of care so I can then bill you. So level 1 is $5,099 a month for a single room. A suite is $5,857 a month. A level 2, meaning you need more help, is $6,023 a month for a single room and $6,781 for a suite. And then memory support is $6,847 a month. And that's for all fee-for-service, limited life care. You're at day 366. Assisted living, 5% monthly discount for fee-for-service and limited health care. So I'm going to tell you what the actual discounts are monthly that you will see. So for a level 1, you will get a $255 credit on your Westminster statement monthly. In a suite, you'll get $293 a month credit. Level 2, $301 for a single room and $339 for a suite. The memory support is $342 credit. So we do give you some money back for having a contract. Healthcare, if you moved in prior to July 31st, or signed your contract before that, and you have a fee-for-service again, or a limited, this excludes life care. Life care, close your ears. The daily rate for you, for July 31st residents, is $344 a day. And the discount is $17 a day. For skilled care, 6 Hearthside, if you are private pay up there, not under Medicare Part A, it's $524 a day with a 5% discount of $78.60. Now for the people after August 1st, 2019, again, exclude life care. For intermediate care, which is regular nursing care, the daily fee is $414 a day, higher than the previous one. That is why they get a 15% discount, which makes it about the same, or around the same. Skilled care, again, if you're there privately, not under Medicare, it's $524 a day and a $78.60 rate. Please don't forget tax deductions. When you're residing in assisted living or health care and you're there for a medical reason, you can deduct your monthly fees along with your drugs and your medical supplies and other medical things that you are billed 100% from your taxes. Now in assisted living, there's a little catch in the rule. And that catch is that you have to be receiving help with at least 2 activities of daily living and have been receiving that care for more than 90 days during the year. And if you don't know what activities of daily living are, it's you can feed yourself, bathe, perform personal hygiene, dress and undress unassisted, maintain continence, and transfer or move your mobility safely and unassisted. Additional charges in assisted living and healthcare. Sorry. These are the other pages in your contracts. Charges not covered under your contract. See page 7 of your contract. Most contracts under page 7, it lists these items. Prescription costs. Our pharmacy is Farm America that we are contracted with for healthcare and assisted living. They will file your prescription with your insurance. Your insurance then determines what your responsibility is, and that's what you will be billed. So this is where you run into right now is Medicare Plan D open enrollment season. And some of the plans, you pay a percentage of the drug cost. So if it's not a set copay, like $5 for these drugs, you have to pay 25%. It's going to be, what you are billed is going to be based on what Farm America is buying it for, which can fluctuate. Same with your CVS, Walgreens, all of them. Excuse me? And D. Yeah, right now, Plan C and D, open enrollment. Over-the-counter drugs, they are usually not covered by insurance. I've never seen it covered by insurance. But their costs are not very high compared to other places. Another thing is, for our life care contracts and our limited life care contracts, there's an additional fee for your 2 additional meals a day. Fee for service contracts and the 366-day contracts, that is already included in your daily or monthly fees. So you are not subject to this. This is just for contract residents. Yes, ma'am?
Does that mean you'd be eating 5 meals a day?
No. She asked what that mean if you're eating 5 meals a day, and no. You're currently in your contract rate is 1 meal a day. So we have to offer you 3 meals a day, so that's for the 2 additional meals a day, which is cheaper than a Happy Meal. It is. You'll be responsible for the cost of medical supplies and nutritional supplements like Boost and Sure, those lovely things. Medical equipment like alarms, like for the bed alarm, chair alarms, Wander Guards, oxygen equipment, several different things. And therapy, we will file your insurance. You will be responsible for any remaining balances after insurance. So as long as I have current insurance cards, we will file your insurance, and your insurance will dictate what you are responsible for. Now, sometimes you'll have to sign a form when you go have therapy that tells you what your responsibility is. We run that in our office. It may say you have a $30 copay every visit. We do not bill that to you until we get the explanation of benefits back from the insurance company. Because the first thing they say when we call is this is not a guarantee of benefits. So they could actually cover that cost or they may not. So that's why we don't bill it until we get payment. Examples of some of these ancillary charges I've been talking about. Here are the costs currently. Laundry is $18 a load. There's a young lady, we do your laundry individually. We have regular household washers in the second floor, and they do your load individually. Where other nursing facilities throws everybody's stuff together, that's why you need to label it. So we use a regular washing machine, unlike a commercial that could wear and tear your stuff faster. The lady who does your laundry also irons and hangs it up, etc. So that is why it's $18 a load. Doctor transport, $10 round trip. Bed alarms, $2.42 a day. Chair alarm. So these are pads that go on your bed or your chair, and if you try to get up, it notifies nursing that you are getting up on your own. Nebulizer, that's like a breathing treatment that I need now because of my cold, but it's $31.50 a month. Oxygen concentrators, those are those big machines that you wear a little cannula, that's $244.50 a month. Secure care transmitters, those are on the healthcare floors in assisted living. If someone is a wander risk, or has dementia, Alzheimer's, or is not a fall risk. I can't remember the word right now, but anyways, you get charged this once a year. They wear it either on their wrists, their clothes, their but their ankle, wherever. And what it does is when they go to an elevator, it sounds an alarm and the elevator won't move. Or if they go to a door, it sounds an alarm. Project Lifesaver is $31 a month. It's the same kind of concept, but it's for memory support. If a memory support resident gets lost, we can find them via the system that runs this. Now, anything with a red star next to it is 100% covered by Medicare when you are in a Part A skill stay. So when Medicare is covering your room and board and your drugs and medical supplies, it's going to cover these items also. And the next favorite subject, health insurance. Long-term care insurance. Long-term care insurance helps pay your monthly room and board while you're in assisted living and health care. These policies can also help with home health for someone to come in your home so you can stay home longer. These policies have a daily reimbursement amount that they will pay you, or they have a cash reimbursement. Regardless of what I bill you, this is how much they're going to pay you a day. I've only had a few of those. Mostly it's whatever I bill. If it is less than your daily reimbursement, they're only going to reimburse you what I bill. If it is more, you pay the difference. If you have a long-term care policy, make sure another family member, responsible party, power of attorney, knows this policy and has a copy. Side note, make sure I know you have that policy too. Marketing does a good job of taking your assignment page from your long-term care and scanning it to your account, but sometimes I don't have it, so it's good for me to have also. I think I got yours already. He asked me if I wanted a copy, and I already have one. One of the above people will be responsible for starting the claim. So the facility doesn't start the claim. This is a claim that pays you directly. Some policies let you assign benefits to the facility that they pay us directly, but the majority of the time they pay you directly. So either you or your spouse or your power of attorney needs to do this, and if they need help, I'm here to help. And April will be soon too. Please send the long-term care insurance company a copy of your power of attorney now, because that will delay the claim process if they don't have it on file now when it's time to file a claim. And they usually take 45 days to 90 days or so to start the claim. So we want to make sure they have everything they possibly need as soon as they can. If unsure what it covers, bring the policy to me and we can go over it. If you get letters from your long-term care insurance policy that is saying we're going to jump your rates by 100%, if you're unsure based on your contract, if you should change your policy, that's something I can help you figure out too. Medicare. Medicare Part A skilled care. In our 6 harsh side, covers medically necessary hospital stays, skilled nursing facilities like us, limited home health care, hospice care, and blood. Medicare Part B covers your medical necessity doctor visits, outpatient procedures, therapies, some durable medical equipment like walkers and wheelchairs. Wheelchairs, you can get a new one every 5 years. Laboratory services, radiologists. Look at your Medicare and U 2025 manual that you recently got, and it will have listed in there what Medicare covers. When you're having a procedure done at any doctor's office, even as I was talking earlier that we have a form we fill out for you, they should be letting you know what your responsibility is. So when you sign your paperwork, make sure you're paying attention that you're not saying something that just says, I'm responsible for all costs. You want to know what those are, and they should tell you. My favorite, Medicare Advantage plans, Medicare Plan C. Medicare Advantage plans is an all-in-one alternative to Medicare. They came around at the same time Medicare Plan D came into effect. These plans cover your Part A, Part B, and Part D, which is your prescription, and usually some other benefits like dental and vision. In many cases, you will need to use a doctor in their network. If your doctor is not participating with your plan, or you do not have outpatient benefits, or out-of-network benefits. Your doctor or even WC may be out of network and not covered under your plan. I currently am working with these plans trying to get us in network. It's been over a year with United Healthcare, and I still don't have a contract. So make sure when you sign up for these plans or listen to the commercials on TV that you understand what it covers before you determine to purchase one. The majority of these plans require pre-authorization and approval prior to receiving skilled and therapy services at WC. Your doctor may say you need skilled care, so we will send your insurance company your medical records. They may determine, that's nice, you need skilled care, but we're not going to cover it because we don't think it's medically necessary. But you do have a right to appeal it, and people have won appeals. Deductibles and copayments. You will have out-of-pocket deductibles and copayments. Make sure you are aware of these additional charges. And again, please check to see if we're in network with your plan. If WC is not in network, please make sure your plan has out-of-network benefits. Can you cancel a Medicare Advantage plan and change back to regular Medicare? Yes, you can at any time. If you have done it within the last 12 months, you can re-sign up for Medicare and get a supplement plan with no medical questions if it's within the first 12 months. After that, Medicare has no problem taking you back. It's a supplement plan that might be the issue. And that would be they can hold pre-existing medical conditions against you. But people have canceled their plans after 12, 13, 2, 3 years and been able to get a supplement plan and get a Plan D, no problem. So it's not the end of the world. Now, the Medicare Advantage plans with employers or retirees. These are great plans. They really are. Because your employer went out and went to these companies and they have hundreds of people instead of an individual. And they're trying to get you the same coverage you already have. So most of these plans do have out-of-network benefits, and they do cover much better than if you had purchased it out on your own. So they are good plans. Supplemented and secondary insurance. So if you have Medicare primary, you will have a secondary plan that hopefully will cover everything after Medicare. Because Medicare has copayments and deductibles that you are responsible for, like your Part B deductible every year. They only cover, 80% of therapy, so someone's got to pay the rest. What your supplement, so some ideas of what your supplement insurance should cover. Hospital copayments and deductibles. Skilled nursing stay days 21 through 100, because day 1 through 20 is 100% covered by Medicare. But day 21 through 100, there's a copayment. Medicare deductibles and copayments. Prescriptions if you do not have a Medicare Plan D policy. Important. If Medicare denies a payment for a procedure that you had that's not covered by Medicare, your supplement plan most likely will not cover. Doesn't mean not to try. These type of plans, I'm trying to get this thing off here. These type of plans do not pay secondary to a Medicare Advantage plan. So if you have a Medicare Advantage plan, you should not have a supplement plan with it because they will not pay secondary to a Medicare Advantage plan or a Medicare Plan C. So here are the Medicare deductibles. I gave you I'm giving you 2024 and 2025 since we're almost there. So for day 21 through 100 until December 31st, it's $204 a day. As of January 1st, it goes to $209.50 a day. The Medicare Part B deductible this year was $240 one time. This year, it goes up to $257. Hospital deductible. So the first day you hit the emergency room, they're going to charge you $1,632. And I have on here, it says benefit period. A benefit period for Medicare when it comes to skilled and hospital care is 60 days. So basically, if you go to the hospital today and then come home, if you go 60 days with no other skilled care going to the hospital or rehab, this resets and you have to pay it again. For 2025, it's $1,676. I feel your pain. My husband's on Medicare. Hospital days 61 through 90. Day 1 through 60 is zero copay, but I don't think people stay in the hospital that long anymore. It's $408 a day, and for 2025, it's $419 a day. So prescription insurance, Medicare Plan D, we're currently in open enrollment. If you need help, let us know, and we can help you with this. Medicare.gov is a great resource to look at the different plans that are available to you, and you can create yourself a username or password, and it even pulls all your prescriptions in. You need to look at this plan yearly because the plans change yearly. Like for 2025, we all need to say thank you, Jesus. They eliminated the donut hole. So there's no longer a donut hole. Your max out of pocket is $2,000 for covered prescriptions. So if your plan doesn't cover a prescription, it's exempt from that. So the max out of pocket is $2,000 this year, which is great. So once you meet the $2,000, your drugs cost you nothing. So I'm so happy to see that. It only took 20 years, but it's done. But you need to look at your plans yearly because plans get eliminated. So you have to choose something else or they'll force you onto one of their other plans. Your premiums could go way up high, go down. Your drugs could change during their year. To pick a Plan D, it's based on your drugs, not the name of the insurance company. When you pick your supplement insurance, secondary to Medicare, you pick it based on the company's representation. And when it comes to your drug plan, you're picking it based on your combination of drugs. It doesn't matter if it's Anthem, AARP, or somebody else. It's your drugs that matter. Now, you can have supplement RX insurance with your supplement insurance with that pays secondary to Medicare. Some of those plans, some people still have their RX coverage through there. And then Medicare Advantage plans have them also. And yearly, if you have the supplement RX, like if you're Anthem, remember back then it was like Anthem Plan J had drugs. If you kept that plan, they should be sending you a letter every year that tells you if your drug plan is equal to or better than a Medicare Plan D program. So if you get that letter, that's why. Like I said, WC is a contract with Farm America. You should never receive a bill directly from Farm America if you're in assisted living or healthcare. If you do, please bring it to me. We bill you for your drugs. We attach a copy of the Farm America invoice for your information purposes only. Any attachment that you get with your Westminster bill, do not pay separately. It is for information purposes only. Farm America does work with TRICARE and VA benefits to get your medications. You'll need to work with our Director of Nursing. Healthcare, that would be Ashley Lawson, and assisted living, you probably would work with Lene. And your insurance company and Farm America to set this up. This can be done, but please be aware that you will be billed repackaging fees for your prescriptions. That's what the pharmacy does. And last time I saw it was like $8 for a repackaging fee. Medicare Part A skill stay. If you meet the requirements for skill level of care, which is 3-day hospital stay, and your doctor stating you need skilled care, Medicare will pay 100% for the first 20 days. If you do not have Medicare primary, as I was saying, if you have a Plan C or retirement plan, it might not, a lot of them are 20 days, but some of them may not be 20 days. Once you reach day 21, Medicare will cover everything but the copayment of $204 a day for 2024. If your insurance does not cover this $204 a day, I will be billing you this $204 a day. What does Medicare cover when you're in skilled care? Your room. Meals offered in the skilled unit. So if you are on a meal plan, I will credit you back your meals that you don't eat. All prescriptions and over-the-counter drugs. Therapy. Medical supplies. Laboratory services, radiology, ambulance, transportation, durable medical equipment, even outside providers. There's something called consolidated billing when you're on a skilled level of care. Westminster is responsible for a lot of your doctor visits. Some we are not, but there's a lot that we are, especially if you're having a procedure done. New Medicare cards. So apparently, in 2023, there was a data breach. And they got some people, it was like 1 million people, information in their Medicare numbers. I would think by now, if they were going to do something, it was 2023. We're almost in 2025. But however, they have decided to issue cards to people who were affected by this, not everybody. If you were affected, you would have received a new card already. Once you receive your new card, destroy the old Medicare card and start using your new one immediately. Make sure to notify all providers, all doctor's offices, Westminster, Canterbury, everybody that bills insurance for you of your new number. And again, bring the card to the accounting office so we can update your records. And on that, because that has just happened, it makes our scam people go crazy because they then will call you and say, oh, you're part of this thing and you need a new Medicare card. Medicare and Social Security and CMS, which is Medicare also, will never call you. They will send you an official letter in the mail. That's the only way they communicate with you. The only way they would call you is if you initiate the call. Or you set up a time and appointment with Social Security and they call you. So please be careful if someone calls and says that your Medicare or your personal information has been compromised, to hang up. And also be careful with the mail. I noticed that people bring me pieces of mail, and my husband gets pieces of mail, and it looks like it's from Medicare or Social Security because they put the red, white, and blue on there. They try to copy it. Just be careful. If you do not know if this is legit or you're not sure, you can ask me or ask a friend or your family member before you make any kind of decision like that. Again, whenever you receive new insurance cards, please bring them by our accounting office so we can update your records. January 1st is fast approaching. Some insurance companies issue new cards. Or if you changed your drug coverage, we need to know that information. And again, important pages in your contract that I listed throughout. Page 5, under health-related charges, lists a lot of the health-related items that you could be billed for. Page 7, which explains the increases in the monthly fee, which usually happens every October 1st. Health services and additional dining charges is also under page 7 and explains the 2 extra meals a day for assisted living and healthcare. And here are my lovely websites. Oh, look, I didn't change that. That should say Medicare and You 2025, not 2023. Don't pay attention to 2025. And again, that Medicare.gov is a great resource. That's what I use when I look for Plan D programs. Questions? That's a lot of information. Yes, ma'am.
How much money do you think we ought to be thinking of needing every year?
How much extra money you need, you should be thinking about that you need every year. It depends on your contract and your finances. So if you want to know detailed to yourself, we can sit down and talk about it and go over your contract and figure out what your needs are. Because we have we have the fellowship fund here that helps residents who run out of money between, in independent living or assisted living. And in healthcare, we have Medicaid. A lot of people don't think we have Medicaid. Yes, we do have Medicaid residents. So that's not our goal to put you out on the street. That's why we have the fellowship fund. We're not like other facilities that are for profit, that when you run out of money, we go, hello, come pick up your mom. She's sitting on the sidewalk. We don't do that. We try to help you the best way we can. I know it's a lot of information, a lot of numbers. Yes. Yes. Children should have jobs. That's what I tell mine. Bank of Mom is closed. Yes, ma'am. I didn't quite hear you. Yes, the new Medicare card only affects the 1 million people from 2023. If it affected you, you would have already received a letter and a card. Supplemental insurance had nothing to do, that was just straight, they hacked Medicare and got a little bit of information before they caught them. But it has nothing to do with your supplemental insurance. The only thing with your supplemental insurance is if you get a new one, let us know. Anybody else? Yes, sir.
You discussed Medicare and Medicare Advantage.
Mm-hmm.
Okay? When I watch TV and I see these washed-up actors and sports figures preaching all of God's gift to the world for Medicare Advantage, do you care to explain from your standpoint the difference of a customer having Medicare versus Medicare Advantage?
From my standpoint, the difference between Medicare and a Medicare Advantage plan or Medicare Plan C and the commercials on TV. That I had to tell my husband, Jimmy Walker's being paid to say that. He didn't want to believe me. Or Tom Selleck. If you freeze the screen and zoom in on the small print, it tells a lot. Remember the old saying, if it sounds too good to be true, it might be too good to be true. When in doubt, we can always look up the plan ourselves and see exactly what it covers or doesn't cover. Because like I said, some of the plans are really good. But every once in a while, you get a plan that's not that great. So I have to keep my opinion to myself on that part, though, if I would do it or not.
It took me 6 months to try to figure out the too good to be true.
Yep.
And you can correct me if I'm wrong in stating this. What I learned was Medicare wanted to reduce their total cost per person average.
Mm-hmm.
So they created Medicare Advantage, which tells you you get A to Z, but in reality, many, many more of your requests for approval get denied. Because the medical suppliers, like Westminster, are dealing with professional evaluators at the insurance company versus dealing with Medicare government employees for approval. That's the big difference. And the average cost for somebody in Medicare Advantage to the federal government is a lot less than those of us on Medicare. Therefore, Medicare Advantage saves the government a lot of money.
His point is Medicare Advantage plans save the government a lot of money. Yes, they do. Because your Part B premium is going to them, and they're covering the cost of your care instead of Medicare. So Medicare is saving money because they're not having to pay for your health claims. So that is a very valid point. But again, there are some good plans out there. But you need to be careful what you're choosing. Next question? Really? Yes, ma'am? I will keep you straight when you get in trouble. I promise to be there when you need help. Yes, sir.
For example, a individual fellow has a partner over Woodside, and he has goes into total dementia. So what happens when you
Okay. So he's asking if a resident is in their apartment and they fall and get dementia from it, right? And what happens to get them all the way over to healthcare in regards to insurance and billing? Right. So basically, the first thing we look at is what contract you have, because that determines what you'll be paying. That's the biggest issue. It's the contract you chose. And then we look to see if you have long-term care insurance. So if that fall didn't make you go into skilled care under Medicare Part A, then we're looking to see if you have a long-term care insurance that might need to be activated. And we're looking at your contract. We follow what the contract says. And I can tell you, we have residents that have been here since 1982, and their contract's 8 pages long. New contracts are like 20-something pages long, front and back. So things change over the years. So it's important that we look at each individual contract, because what is written in your life care contract might be different than what's written in hers, depending on when you moved in. All right, so if he, okay, so what happens if he stays in healthcare or assisted living? So basically, if a determination is made that he is unable to return to his apartment, then we would give notice that he would be permanently transferring to whichever level of care he needed. Then he would work with Resident Life and Wellness, or the family would, and usually they give you 30 days to clear the apartment. And then I will start billing you at your contract rate in your new level of care. And I will stop billing you the day you permanently transfer. So I don't wait to day 31 and keep billing you 30 days in there. Once it's made a decision that you are permanently transferred, I stop billing. And then you have 30 days to clear it. And now, now I'm billing you over there. Questions? Are we ready for lunch? All right, no problem. Again, if you have any questions or concerns, come see us, and we'll try to help you as best as we can.